Whooping cough. How do we prepare? What is whooping cough? Whooping cough is a respiratory tract infection. It causes a bacterial infection that is known as Bordetella pertussis. It is spread through sneezing or coughing by getting fluid droplets in the air. It is highly contagious. Unfortunately, symptoms resemble the common cold, and they can take 7 to 10 days to originally appear. Some of the most common symptoms are runny nose, nasal congestion, red watery eyes, fever, and cough. We need to educate the community on how to prevent the spread of whooping cough. The best way to keep it from spreading or to prevent it is to cover your mouth when you're coughing or sneezing. Wash your hands thoroughly and use hand sanitizer. Try to avoid contact with sick people and stay home if at all possible. There are treatments that are available. There are vaccines for those who have not had them. Antibiotics will work against whooping cough since it is a bacterial infection. The infected need to get plenty of rest and drink plenty of fluids. Who's going to be affected the most? Infants are more susceptible, especially those that are 12 months or younger who have not had all of their infant shots on the schedule. Older children and adults that have a weakened immunity due to a failure of immunization are also at risk. So now that we know that, what do? We need to reach out to our communities. We need to speak to practices, other clinicians, see if any of them would be available to help. See if they're available to help, to fill in the gaps when our current personnel needs to have a break. We need to increase our training on how to handle infections and how to stop the spread of this. We're going to run out of space in the hospital, so we need to prioritize who's going to be discharged, who's going to be admitted. We could potentially run out of medical supplies to handle our patient load, so we need to figure out how we're going to meet those needs. We need to train our staff on how to properly disinfect themselves, supplies, and the clinic itself so that we don't spread the disease to everybody else. We need to give pharmacies a phone call. It's as simple as that. We need to call and say, hey, how much of this antibiotic do you have and how much can you spare to help meet our needs? We also need to make sure that our medications that we're dispensing and using are not expired and that all of our supplies are sterile and clean, and they are also not expired. And it's my belief that if we utilize an authoritative leadership style with a transformational influence, that would be best. And what I mean by that is we need to have clear, concise rules, regulations, and policies in place. But we also need to be open to letting our staff chime in if they have ideas on how we could better perform something or do something. This will help keep them motivated, keep them feeling like they're making a difference and that they're important. So now that we know all of that, how do we provide the care? Infants 12 months and under and their caregivers take priority. They are most susceptible to getting an infection. So they must be hospitalized. Next, we need to look at the geriatric community. They are always more susceptible to anything that comes our way, so we need to take care of them. Older children and adults with failed immunity, they can be treated and sent home for self-care. By doing these triage plans, we will be able to treat as many people as possible in the best way possible. If we're going to be able to handle an outbreak should it occur, which we know it's going to, we must first mitigate the risks, develop a plan of action, and take steps to ensure staff will be trained to handle the situation, which is what we're doing today. Medical facilities should establish a plan to treat patients in a home setting versus a facility. So what that means is sending home the older patients who can be put on medication and just need to go home and rest so that they don't spread it. We can administer vaccines for those who have not received them. And if we have those on hand, it will be a way that we can keep it from spreading to even more people. By doing these things, we will be able to handle this situation.